So moving on to fallopian tubes, we briefly talked about this, but again, if your fallopian tubes are obstructed, then unfortunately the probability of pregnancy is very, very low. Now, some of the questions that we had in the submitted to us was, what if only one fallopian tube is open? And so if only one fallopian tube is open, it should not impact your pregnancy rate. Excuse me, what it does is impact your time to pregnancy, meaning that women with one fallopian tube sometimes can take longer to get pregnant. So for example, sometimes women only have, they've had a tubal ligation, and I do a tubular reversal surgery, and for technical reasons, we can only reattach one tube back together. And so the probability of pregnancy in those women is no different than the probability of pregnancy if we put both tubes back together. It just takes longer. And sometimes women are only born with one fallopian tube, and they never know about it because they get pregnant and they don't have any problem. So having one fallopian tube blocked is not really an issue. The issue is fallopian tube function. Any process that causes a blockage of fallopian tube, typically on one side, can cause dysfunction of the tube. And even if the tube on the other side is not blocked, there may be some dysfunction. And so, like we talked about earlier, the most common reason why fallopian tubes are blocked or not functioning properly is a prior infection. Most commonly, it's called pelvic inflammatory disease or chlamydia. And so, if you've had any kind of prior infection, you should be screened or tested for fallopian tube obstruction, because that would be much more common in somebody who hasn't had that risk factor. The other common risk factor for fallopian tube blockage would be something called endometriosis. And typically women go through 5 or 6 doctors and years of going to medical professionals before they're diagnosed with endometriosis. Now, endometriosis typically presents with painful periods, or pain between periods, or painful intercourse. Now, if you're in a position where you dread your periods, they're incredibly painful, you have to take medicines that are more than over the counter during your menstrual cycle, very likely you have endometriosis, and you should ask your doctor about it. And just having endometriosis, even if it doesn't impact the fallopian tube, could put you at risk for infertility or subfertility, because everything about the disorder can impact the probability of conception.